Cancer is a major cause of death all over the world. More than 1 million Indians suffer from cancer, and most part of it die every year. Cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body, which is made up of billions of cells. Cancer can be characterized by the abnormal growth of cells, the ability to invade adjacent tissues and adjacent organs, the eventual death of the affected person if the tumor has developed beyond the stage. Cancer can occur at any site or tissue in the human body and can occur in any type of cells. Cancer can be grouped into the following categories. Carcinomas. It arises from epithelial cells lining the internal surface of the various organs. Examples are mouth, intestine, etc. Sarcomas. It arises from mesodermal cells which forms the connective tissues. Example, fat, bone, etc. Lymphomas. It is the cells which forms bone marrow and immune systems. Now moving to the causes of the cancer. We have two causes, that is environment factors and genetic factors. First two, environment factors. Environment factors are responsible for 80 to 90% of all human cancers. Examples we can see in this image, there is alcohol, radiation, sunlight, tobacco, chemicals, certain foods, etc. Now moving to tobacco, it is the main reason for the cancers in lungs, esophagus, mouth, etc. Alcohol, the excessive intake of alcohol is responsible for esophageal and liver cancer. Dietary factors, this may also cause cancer. Smoked fish is responsible for stomach cancer. Beef consumption is to bowel cancer, etc. Now, the occupational exposures. It includes exposures to benzene, vinyl chloride, etc. Viruses. The study on the viral origin of the human cancers has found that hepatitis B and C virus is related to hepatocellular carcinoma. Lymph cancer may be the late complications of AIDS. Lifestyle. The lifestyle may be responsible for the increased risk of certain cancer. Smoking, alcohol, etc. can be part of the lifestyle. Now, the genetic factors. Genetic influence has long been suspected. For example, retinoblastoma occurs in children of the same parent. However, the genetic factors are very difficult to identify. Now, moving to the diagnosis. Cancer diagnosis methods. First one is the lab test. Clinical chemistry uses chemical processes to measure levels of chemical components in body fluids and tissues. The most common specimens used in the clinical chemistry are blood and urine. Components may include blood glucose, electrolytes, enzyme, hormones, lipids, other metabolic substances, and proteins. The next diagnosis method is imaging, that is diagnostic imaging. Imaging is the process of producing valuable pictures of body structures and organs. It is used to detect tumors and other abnormalities. Moving to the next methods, that is endoscopic exam. Endoscopy is a procedure that allows a doctor to view the inside of a person's body. During an endoscopy, the doctor inserts a tool called an endoscope into a person's body. Most endoscopes are thin tubes with a powerful light and tiny camera at the end. So by using this tube, we can detect the inside of the human body. Now, finally, the genetic test. Genetic tests help estimate your chance of developing cancer in the lifetime. It does this by searching for specific changes in the genes, chromosomes, or proteins. These changes are called mutations. Now, we have tumor biopsies. During this method, doctor removes a small amount of tissue for examination. It is an important way to diagnose many different types of cancer. Now, moving to the treatment part. Certain forms of cancer are we can cure the cancer by surgical removal, and some respond in a positive way towards radiation chemotherapy. Most of the methods have complementary effects on the outcome of the patient, and due to this, multi-modality approach is used as a standard practice all over the world. Now we are moving to the different types of cancer treatment. First one is chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells. It usually works by keeping the cancer cells from growing, dividing, and making more cells. Second one is hormone therapy. Hormone therapy is a treatment that adds, blocks, or removes hormones to slow or stop the growth of cancer cells that need hormones to grow. Next one is stem cell transplant. A bone marrow or stem cell transplant is a medical procedure by which healthy stem cells are transplanted into your bone marrow or your blood. This method restores the body's ability to create the red blood cells, white blood cells, and platelets it needs. And next one is the surgery. Cancer surgery removes the tumor and nearby tissues during an operation. Surgery is the oldest type of cancer treatment. And these are the percentage by which each cancer counts. That is, lungs have 11.6% and breast accounts for 11.6%. And the right side, we can see the mortality rate. That is, those who have cancer, that is 11.6%. Out of that, 18.4% dies every year, that is annually. So following are the list of each different types of cancer, that is which affects in different parts of human body. And next we are moving to the risk factor. What are the risk factors for cancer? Race, family history, diet, chemicals, hormones, agings. And now the prevention, how we can prevent cancer. These are some of the methods that we can use to prevent the cancer. There is control of tobacco and alcohol consumption, personal hygiene, reduction of radiation, control on occupational exposures, immunization, control on air pollution. So how to stop cancer? So the ways to reduce the cancer are listed. We can see some of them. Do not smoke or use any form of tobacco. Make your home smoke-free. Enjoy a healthy diet. Breastfeeding reduces the mother's cancer risk. Vaccinate your children against hepatitis B and HPV. Avoid too much sun, use sun protection. Reduce indoor and outdoor air pollution. Be physically active. Limit alcohol intake. Take part in organized cancer screening programs. So these are the methods that we can use to reduce the cancer. So by this slide, I am ending my presentation. Thank you.